feel like I'm exposing the inner workings of insurance-based medicine. Because of how insurance works and scheduling works in a traditional healthcare model, we're often told that we're not allowed not allowed to address multiple different concerns in the same visit. So you're booked for a visit type, and you need to only do the things that fit within that visit type. And so people would come in for an annual exam, and then they would have a problem, and then they would be told you have to come back to talk about that problem, which just fragments care, it disrupts care, people don't come back, they don't actually want to follow up with whatever concern they had. And so that's really challenging when you're trying to just have a conversation about your health, to be told that your concern doesn't fit into your visit type. So that's really frustrating. And then with so many insurance-based practices right now, access is really difficult. People are having a really hard time just getting in. So I would have patients who would wait months, years to be able to get in for an exam or to address their concern, and it just didn't feel good anymore. We've all called a doctor's office and it feels like you're screaming into a black hole. You just never know where the call's gonna go or the message is gonna land or who's gonna touch it and who's gonna call back and when and ever. And so the idea that patients can just reach directly out to me with concerns is very appealing, both from the patient side, but then also from my side. So much gets lost in translation that by the time messages actually arrive on my screen, they've already had weeks of interactions that I've never even seen. So I really like that direct connection. And then again, just back to the time. I can spend as much time as I want with somebody. It's completely up to me and to the patient and what they need. And that is what I want more than anything.